On this Friday night, too many patients, not enough staff. Canada's hospitals buckling under pressure.
This is really the heartbeat of our health system, and if we're saturating that, we are in trouble.
And the dire predictions of a tougher winter. The two teenagers accused of murdering a Calgary police officer on duty.
He's everything you would want in a quality police officer.
Life after Brexit.
We've been let down, indeed we've been betrayed.
How the divorce deal leaves the United Kingdom divided. And special deliveries.
It gives a little cheer for the whole unit.
The first babies to be born in a brand new year.
Global National with Donna Friesen. Reporting tonight, Sonia Diol.
Good evening. Thanks very much for joining us. It is the start of a new year and many Canadians across the country were able to ring in 2021 at home with their families. But for frontline healthcare workers, it's been a very different story. Many of them among those working as the clock struck midnight. They're struggling to get the upper hand on a sharp surge in COVID-19 cases. Hospitals in virus hotspots are losing ground across the country, and that is leading to major concerns about burnout.
We are absolutely in a public health pandemic crisis right now. We are seeing higher case counts, but more importantly, we're seeing more of a strain on the health system than ever before.
The situation is especially bad in Ontario, where they've had days of record infections and hospitals are now in a real crisis. As Sean O'Shea reports, some doctors are warning Canadians to get ready for a much tougher winter.
A new year, but a persistent pandemic, and one that is only getting worse, especially in hospitals and healthcare centres.
I think the people of Ontario should brace themselves for any possibility.
Coronavirus cases filled up Ontario's hospital in spring, trailed off in summer, but have been climbing steadily through the fall, spiking since Christmas. There are now 1,200 COVID-19 patients in Ontario hospitals, 337 in intensive care units.
This is really the heartbeat of our health system, and if we're saturating that, we are in trouble.
We should be taking this seriously well before these numbers were this high.
Behind growing numbers, real people who've lost their lives to COVID-19, like Jenny Ewan's grandfather, Chok Ping Lau.
My family is obviously very upset about this. Grandpa would have been there at Christmas time if it had been any normal year.
Ewan wrote about the Toronto nursing home where her grandfather died before Christmas, the Tender Care Living Centre. He was one of 52 residents to lose their lives in a COVID-19 outbreak.
The residents of these long-term care homes are people that built our country. They deserve a lot better. They don't deserve to be left alone to die on their own, even if it is a pandemic.
And this warning from the Ontario Hospital Association.
It's a very difficult position that Ontario is in, and the winter is looking like it will be brutal in terms of the fight.
In Alberta, with the highest hospitalization rates for COVID-19 in the country, tents have been set up to help treat patients.
It's a terrible, brutal, lonely way to die.
For people that might not have taken this seriously before, perhaps this is a wake-up call when you're starting to see your healthcare system stretch beyond capacity. And for example, hospitals, they're not able to care for people the same degree that they did before just because of the influx of patients with COVID-19 requiring admission and care.
Doctors are pleading with Canadians to do their part.
Please stay home. I know there's a strong desire to visit family and friends, but your decisions today can save lives. Wear masks, physically distance, and follow public health guidelines.
Even if precautions are taken, experts warn the worst days are still ahead. Sean O'Shea, Global News, Toronto.
Alberta Premier Jason Kenney says he takes a responsibility for some controversial travel taken recently by senior government officials. This week, he called his Municipal Affairs Minister, Tracy Allard, back from a Hawaiian vacation with her family. Kenney says he knows other government staff have also travelled abroad recently and says technically they didn't break any rules. That's despite recommendations against unnecessary travel.
I believe that these individuals acted in what they believe to be good faith, have complied with the legal requirements, including the COVID public health orders. But for those of us in leadership, I acknowledge that is not good enough. We should be here at home, plain and simple, if we carry a position of public trust.
Kenny's now ordered all cabinet ministers and senior government officials not to leave the country unless it's for urgent government business. Scientists around the world are working to track down cases of a new variant of COVID-19. So far, it's been identified in at least 33 countries, including Canada. The variant is believed to be more transmissible, and as Ross Lord explains, that has health officials in this country concerned.
As countries worldwide examine the new variant of COVID-19, the top scientist at Canada's National Microbiology Lab says there are troublesome indicators.
The changes in that variant may make the spike a little bit stickier. So it makes it a little bit easier to interact with its target. And that may be a reason for the observation that it may be more transmissible.
The variant is definitely getting around. In addition to the UK, which has imposed strict lockdowns to limit its spread, the World Health Organization says the variant has been reported in other countries or territories. In Canada, the number of infections is relatively small, but the variant is showing up in a growing number of provinces. Epidemiologists say there's no evidence the variant is more deadly, but it does appear to be more contagious, and that raises the stakes for Canadians.
If you increase transmission by 50%, then you have a higher proportion of people entering the hospital system, a higher number of people entering the hospital system. So the probability of an overwhelmed system just got higher.
Epidemiologist Rewat Deonandan says current vaccines should still be effective. But he says there are still many unknowns about the variant, including how it spreads among children. The National Lab suggests Canada is on top of COVID science.
We've been able to date to sequence about 1 in 20 of every case that has been detected in Canada to date.
1 in 20 might not sound impressive, but Dr. Poliquin says that sequencing rate is equal to or better than most countries, suggesting policymakers will be guided by solid evidence in navigating which new measures to take in the new year. Ross Lord, Global News.
Well, in the U.S., this new variant of COVID-19 has now been found in Florida. Health officials confirm it's been detected in a man in his 20s with no recent history of travel. Authorities are now trying to pinpoint the source. The new variant has also been found in Colorado and California. Experts believe it's likely spreading in other parts of the U.S. as well. And the new year has started on a somber note in the US. The number of confirmed COVID-19 cases is now more than 20 million. The race to vaccinate millions of Americans is on. So far, just over 3 million doses of coronavirus vaccines have been administered. Many say the rollout is still not moving fast enough. Medical experts warn it's going to take several months for enough Americans to be vaccinated to turn the course of the pandemic. Jennifer Johnson reports.
In Florida, the elderly and healthcare workers are camping out for hours, waiting to be vaccinated. Phone lines crashed trying to take appointments. Now it's first come, first serve.
I blame our whole government. I mean, I totally blame our government that this is not what it should be.
I did not expect to be sitting here since 3:45 this morning.
There are similar scenes in other states. In Tennessee, there are massive traffic jams as people await their inoculations. The Trump administration's Operation Warp Speed left each state decide how the shots are distributed, adding more pressure on regions already overwhelmed with testing and hospitalizations.
If we're not able to get through that first phase as fast as possible, that's going to push the whole chain down in terms of time. And as we're seeing, every day means lives, thousands of lives.
President-elect Joe Biden is pledging to get 100 million shots administered in his first 100 days in office, using the military if necessary to speed up the process. Meanwhile, in Wisconsin, police have arrested a hospital pharmacist accused of intentionally spoiling more than 500 vaccine doses.
The 57 recipients of those vaccines have been notified. At this time, there is no evidence that the vaccinations pose any harm to them, other than being potentially less effective or ineffective.
Los Angeles County is now the country's epicenter of the pandemic, with ICU beds and morgue space exceeding capacity. After a heartbreaking 2020, healthcare workers across the country are hoping for better days ahead.
I'm looking forward to paying back some of the precious time I've missed with my family due to the demands from coronavirus.
I want to do more fly fishing and sign less death certificates.
But it may take a long time for those wishes to come true. Americans have rung in the new year, facing another dire warning from the U.S. Centers for Disease Control and Prevention, predicting the COVID-19 death toll will likely hit 425,000 people in 3 weeks. Jennifer Johnson, Global News, Washington.
Israel has vaccinated a larger share of its population against COVID-19 than any other country. 1 million people have now received the first dose of the COVID-19 vaccine. That is more than 10% of its residents. Prime Minister Benjamin Netanyahu was on hand for the milestone moment. There are more than 45,000 active COVID-19 cases in Israel. In the UK, top medical officials are warning that hospitals across the country are at risk of running out of intensive care beds within days as the more infectious variant of COVID-19 is spreading. Emergency field hospitals that were built at the start of the pandemic are now being reactivated to handle the expected surge of new cases, especially in London. University College Hospital, that is one of the largest medical sites, is warning it's on track to become virtually COVID only. The UK has recorded more than 50,000 new daily cases of COVID-19 for the past 4 days. Well, today marks the first day in 48 years that the UK no longer has to follow European Union rules or regulations. The Brexit process took almost 5 years. It also cost 2 prime ministers their jobs. For Brexit supporters, the move away from Europe is all about independence. But as Redmond Shannon now reports, the terms of its divorce deal could now threaten the unity of the UK.
The movement to bring the UK out of the EU goes back decades, and it has some of its roots in British, or more specifically English, nationalism.
Delivering us from 48 years of subjugation to EU laws and European court jurisdiction and regaining our sovereignty.
The UK now has that sovereignty back, the power to strike its own trade deals and to better control immigration. But the price could be a heavy one. Brexit threatens to potentially tear the United Kingdom apart.
On New Year's Day, these trucks arrived in Northern Ireland coming from other parts of the UK, a journey within the country that now requires customs declaration forms for many shipments. That's because the Brexit deal has effectively kept Northern Ireland inside the EU trade bloc. For the province's pro-British unionist community, which generally supported Brexit, it's the worst possible outcome.
I think the deal has made Northern Ireland a place apart. We've been let down, indeed we've been betrayed by the Prime Minister. He promised us there'd be no border down the Irish Sea. He promised us several things. Sadly, he has failed to deliver on them all.
Ironically, for the pro-Irish nationalists who were against Brexit, this all feels like a step closer to their goal of a united Ireland.
Ireland is changing. Ireland is in transition. The next decade will see significant changes in the constitutional framework and make-up of Ireland.
Europe, you are always welcome.
Across the Irish Sea, the Scottish Nationalist government says it wants back into the EU and out of the UK. This year's Scottish elections could prompt a new independence referendum.
The deal is shocking for Scotland. It will damage our economy, it will damage people's well-being, and we didn't vote for it.
But the people of Scotland did not and do not give their consent to be removed from the European Union. There will be consequences to this.
It appears as though resolving one nationalism project has only served to stoke some others. Redmond Shannon, Global News, London.
Tragedy strikes the Calgary Police Service. Coming up, an officer murdered and the 2 teenagers accused. Plus, a tale of 2 American presidents, the vastly different responses to the pandemic. Breaking news in Calgary tonight, where 2 teenagers wanted in the murder of a police officer have now turned themselves in. Sergeant Andrew Harnett died late last night after being hit by a driver allegedly fleeing a traffic stop. Harnett was a 12-year veteran of the force. Prior to joining Calgary Police, he served as a military police officer. The 37-year-old was committed to policing and his community right up until his very last moments.
Part of the reason we've been able to progress this investigation as quickly as we have was as a direct result of some exceptional police work done by Andrew prior to his death. He is helping us solve this and bring those responsible to justice.
19-year-old Amir Abdul Rahman and a 17-year-old boy who can't be identified because of the Youth Criminal Justice Act are now both in custody. Police suspect the younger teenager of driving the SUV that struck Sergeant Harnett and dragged him down the road. Harnett's death has left a huge impact on his colleagues and the community. Flags outside the Calgary Police headquarters are now at half-mast. Flowers have been left near a statue, and there's a growing memorial near to where the officer was fatally struck. Still ahead, Biden time, the countdown to America's next leader and how different he is to the last one. Well, less than 3 weeks from today, Joe Biden will be sworn in as the 46th President of the United States. Biden steps into the Oval Office at a time of unprecedented crisis at the height of the COVID-19 pandemic. Tonight, our Jackson Proskow looks at how he's going to tackle those challenges and how the Biden era will be vastly different from the past 4 years under President Donald Trump.
When Joe Biden steps onto this platform to take the oath of office, it will signal a dramatic shift in America's pandemic response. The inauguration itself will be a scaled-back, mostly virtual affair, in stark contrast to crowded events held by President Donald Trump during the most dangerous days of the pandemic.
We have a president who has not acknowledged the burden that this disease has had at all, other than his own brush with the virus and talking about how essentially easy it was for him to, quote, get cured.
No country has suffered as badly, and few leaders have been as openly defiant of the virus.
The virus will disappear. It will disappear.
Wear a mask. Americans may be surprised at how vastly different things will look under President Biden, beginning with his call for a national mask mandate.
We could save tens of thousands of lives if everyone would just wear a mask for the next few months.
Where Trump focused almost exclusively on the development of a vaccine, Biden has said he wants to get the pandemic under control now to bridge these deadly days and the day when most Americans are eventually vaccinated.
Making the case to the American people that whether or not you thought this was a good idea a year ago, now that there is a vaccine on the horizon, what you want to do is hold out until you can get it.
While Trump rallied against lockdowns for damaging the economy,
we can't have the cure be worse than the problem.
Biden has argued things can't return to normal if the virus is still spreading rapidly.
The Biden administration has been pretty clear that they see that the key to restarting the economy is to deal with the pandemic. So they don't see these two things as being in conflict with each other.
The biggest difference may be in the simple acceptance of science. Trump promoted bogus cures.
And is there a way we can do something like that by injection inside or almost a cleaning?
And mused about firing experts like Dr. Anthony Fauci. Biden has made Fauci lead medical advisor on the pandemic. None of that will end the bitter ideological divide. Masks are still highly contentious, so are shutdowns. Biden himself has admitted there's no magic cure for all the suffering. The biggest change may be in the way the new administration communicates with the American people. Expect more experts, more consistent messaging, and more signs that the White House is actively engaged in controlling this once-in-a-generation crisis. Jackson Proskow, Global News, Washington.
Up next, midnight arrival, how a family's firstborn marks a Canadian first. Well, a brand new year, meaning brand new babies. Many fresh faces were welcomed into the world today. A Montreal baby is believed to be the first baby born in Canada in 2021. Little Arthur arriving precisely at midnight. Less than a minute later, baby Thomas making his debut in Toronto. Erica Vella has more on those bundles of joys that are celebrating a new beginning.
It was a surprise.
What started out as a pandemic pregnancy, now a New Year's baby. Meet Thomas.
Sleepy little guy.
Born 48 seconds after midnight at Humber River Hospital. He came 1 week early.
We're planning to have baby next Friday, but it just happened. It was really fast.
Excited to ring in the new year after a difficult 2020.
It's been
a very unpredictable time. So like, we're not really sure what we're walking into usually when we come onto the floor. So it's kind of nice to end on like a nice sweet note that we do have the midnight baby.
Thomas was followed by at least 3 other babies born in the Toronto area. Other hospitals had their first baby several minutes past midnight. For those nurses and doctors helping to deliver the newborns,
it gives a little cheer for like the whole unit that's been working hard for the whole year.
Just like the name. As for Thomas and family, 2021 is off to a good start.
He's doing well. He's had his first bath, so he's doing well, and parents are really excited. And I think overwhelmed with how big of a celebrity he is.
I think I was pretty hopeful about 2021 beforehand. He's definitely a welcome addition to the family.
A sign of a new beginning in what will hopefully be a much more positive year. Erica Vella, Global News.
And that is Global National for this first Friday of 2021. I'm Sonia Dion, and we're going to leave you tonight with a new take on an old New Year's Day tradition.
Happy New Year, everyone!
Ouch. Backyards replacing crowded beaches for Canada's first virtual polar bear plunge. The brave tapping into their creativity, getting cold for a special cause in the Courage Polar Bear Dip, raising money for World Vision Canada's clean water projects. Happy New Year. Thank you very much for watching. Good night.